The C.W. Williams Community Center presentation, as previously stated by my teammates, the purpose of this is to analyze and present solutions to real issues the healthcare organization will encounter. The C.W. Williams Community Center has various options that they will need to address. What are the various types of contractual options available to the center? There are several contractual options that are available to C.W. Williams. However, the contractual options vary in nature and work that will need to be accomplished in the duration of time to be taken as complete. The first option involves hiring a director of finance after the person who held that such position resigned. The best contractual option in this case will be open-ended, as the person will be appointed and will serve for an indeterminate period. Fixed price contract is another contractual option that is available to the healthcare facility, which will enable it to buy a location to facilitate expansion of the hospital. In this case, the healthcare would be required to provide a market price for the cost of the land and all other expenses, as in agency fees that would be incurred. Since the healthcare facility is not willing to buy the location now due to lack of finances, the market price of the location should be based on future market value, or what the future value of the property needed will be. C.W. Williams Healthcare Facility is also required to hire medical staff that will provide services to patients during times of physician shortage. Nevertheless, it cannot be able to get the physicians to work on a contract basis due to the shift in healthcare from fee-for-service to a managed care environment. In addition, there are physicians that are in contractual relationships that are prohibited to work with the hospital. In these cases, C.W. Williams has no option but to hire physicians for a fixed contract rate when it expects to experience physician shortages. These physicians also will be able to help the hospital operate an on-call rotation schedule, which will effectively fill gaps created by physicians who are on leave, or fill those gaps in the event that the physicians are being recruited or on a sabbatical. This way, the hospital will be able to operate effectively without experiencing any great shortages. In addition, it will help cater to the healthcare that is experiencing the shortages while waiting for the new recruits. Another consideration that the hospital will have to look at is the anti-kickback and Stark law implications for the community health center. The anti-kick statute prohibits the exchange of anything of given value in a healthcare program to reward or induce a referral of that healthcare program. The health services are being provided within the health facility, and it doesn't involve referring to an outside party. That means that there's no violation in that matter. However, similarly to the anti-kickback law, the Starks law prohibits the physicians from referring health services to Medicaid or Medicare patients if the physicians that are seeing them are immediate family members or have a financial interest in the entity. In the above contractual options, the services have been rendered with institutions. In other words, the health services are provided with Williams Care Health Facility, meaning that any referrals or any care that is being given is given within the grounds of the Williams Health Care Facility. So as a consequence of that, the Stark law does not apply, and there is no conflict of interest for the Williams Health Facility as far as anti-kickback and Stark law is concerned.